When a person has difficulty swallowing, medication can be placed into the fatty tissue using a needle just under the surface of the skin. We refer to this as giving the medication subcutaneously. Typically, the visiting nurse will start and change the subcutaneous line as needed, and will show you how to administer medication through this line. The small needle inserted under the skin has a tube with a rubber valve or injection cap on the end of it. This line can often stay in place for 5 to 7 days before it needs to be changed. The supplies you'll need are a pre-filled syringe of medication prepared by the visiting nurse or pharmacy with special connector attached, pre-filled syringe of 0.5 cc sterile normal saline solution, alcohol swab, and a sharps container, which may be available through home care or a pharmacy, or you may have to use a glass jar with a lid. It's important to wash your hands before and after giving any medication.
Hi, Irv.
Hello.
How are you doing?
Okay.
Yeah, I'm here to give you your medication.
When you're ready to give the medication, make sure the line is properly in place.
Yeah.
If there's any redness, swelling, and/or discharge where the line is inserted into the skin, call the nurse for further instructions.
Causing any pain?
No.
Clean the injection cap at the end of the line with an alcohol swab for 30 seconds using a circular motion. Check the label on the syringe to ensure you're giving the right medication at the right dose and at the right time, as prescribed by the healthcare provider. Before using a pre-filled syringe, it's a good idea to gently roll it between your hands. This ensures the medication is mixed, with no particles settled in the syringe. Insert the tip of the connector of the syringe into the injection cap and gently draw back on the plunger of the syringe. If blood appears in the tubing, a new site will have to be established. If no blood appears, slowly push the medication into the line. Remove the syringe and discard it into the special sharps container. There will still be a small amount of medication in the line. You want to be sure that every last drop gets into the person's body where it can be absorbed. So a small amount of sterile normal saline solution is used to flush the medication through the line and into the tissue. Remove the protective cover from the pre-filled syringe of saline solution and administer it in the same way you've given the medication.
Perfect.
Discard the syringe into a special sharps container. Document the name and amount of medication and the time it was given in your medication record.